The NHS provides a very wide range of different health services. This film tells you about some of the healthcare staff and clinics that provide these services. They provide specialist help, and you can go to some of them without visiting your GP first. If you need help at home, at school or at work, you may get help from a community nurse. Community nurses work in places where people live and work. They may be called district nurses, health visitors or school nurses. Some community nurses work mainly with children and families. Some work mainly with older people. Community nurses work with people who are ill, but they also encourage people to live healthier lives. District nurses help people in their homes. For example, people who've recently left hospital. Public health nurses give advice to people about their health. For example, new mothers and older people. They also check that babies and children are healthy and growing properly. If you're pregnant or have recently had a baby, you may be helped by a midwife. A midwife will work with your GP and other healthcare staff to help you and your baby stay healthy. Midwives give care, help and advice before, during and after your pregnancy. They'll give you advice about how to prepare for giving birth. They will also check your baby's health during labour. They will help you and your partner during labour, give you advice on how to reduce the pain, and help you as you give birth. They can give advice during and after pregnancy, and help you with being a new parent. Midwives will also give you and your baby care and help immediately after the birth, and for up to 28 days after, if you need this. If you need help or advice about sexual health, the NHS provides special clinics. Sexual health clinics are sometimes called sexual and reproductive health clinics, family planning clinics, or GUM clinics. They give advice on how to avoid getting pregnant, contraception, and how to stay healthy. They can do tests and give medicines for infections caused by having sex. They can give you advice about becoming pregnant and what to do if you are pregnant but don't want to be. You don't have to see your GP first to use these clinics. You can go to them whenever you want. The clinics are confidential and free. You can ask to see a male or female doctor or nurse. The NHS can help if you're having problems because of the way you think or feel. These are called mental health problems. Your GP may suggest that you see a community psychiatric nurse, sometimes called a CPN, a psychologist or a counsellor. These health professionals specialise in mental health problems and can help you by talking to you about your feelings. Your GP may ask you to see a psychiatrist. This is a doctor who specialises in helping people with mental health problems. Your GP or psychiatrist can prescribe medicine or other kinds of treatment. If you think you have a mental health problem, make an appointment to see your GP and ask for help. The NHS also provides dietitians, who can help people change what they eat to improve their health. Dietitians can help people with problems like diabetes, being overweight, heart disease or cancer. Your GP may send you to a dietitian, or you can ask your GP if you want to see one. If you have problems with moving because of injury, illness or age, the NHS provides physiotherapists. Physiotherapists help patients in different ways, for example with massage or exercise. Your GP can arrange for you to see a physiotherapist. In some parts of Scotland, you don't need to see your GP first, and you can make an appointment yourself to see a physiotherapist. Ask at your GP practice about what you need to do. If you have problems with your feet, you can see a podiatrist. Podiatrists, also called chiropodists, give advice and help people who have problems with their feet, such as bunions, corns or infections. They also advise on how to avoid these problems. You can get free NHS help if you have problems with your feet, and if your doctor sends you for treatment. You may also get free help if your GP thinks you may have problems in the future because of a medical condition. For example, diabetes. You'll have to pay to see a podiatrist if you're not sent by your GP. This film has shown some of the wide range of services which the NHS provides in Scotland. You can use some of these services without seeing your GP first. There are many other services, and your GP will send you to a service if they think you need it. You can find out more about NHS services and find local services by looking at the NHS24 website at www.nhs24.com or by contacting the NHS helpline. Phone 0800 22 44 88. Text phone users dial 18001 0800 22 44 88.